everyone, I am Dr. Nitesh Jain, Senior Consultant Urologist, Laparoscopic, Endoscopic and Robotic Surgeon at Apollo Hospital, Chennai. My main area of interest is also transplant surgery. Today I will be speaking to you about recipient transplant, kidney transplant surgery. How safe is it? Well, it's quite a safe procedure, and here in Apollo Chennai, Greams Road, we are doing it for last almost 35 years. We do it quite regularly. Let me tell you why exactly the kidney fails. There are various reasons of kidney failure. It can happen because of some of the childhood diseases, which like vesicoureteric reflux or posterior urethral valve, or if a patient is having a single kidney and it gets obstructed, leading to infection and the kidney can fail. Or the major cause of kidney failure is diabetes or hypertension. So if diabetes or hypertension is checked timely, probably we can prevent a vast majority of kidney failure. So once the kidney failure happens, basically the patient is under the care of nephrologist. I am a urologist, we see them only most of the time at the time of transplantation, unless until they also have some major urological issue. Once the patient is on dialysis, dialysis can be done in two ways, hemodialysis or CAPD. It can be done either way, but majority of the patient undergo hemodialysis unless until they are not fit enough for hemodialysis, or they are living in distant location where hemodialysis is not possible. There we advise the patient CAPD. So once the patient is hemodialysis, patient is thoroughly evaluated and the patient is asked to bring his related donor. If once the patient is fit enough after thorough evaluation, both from cardiac, anesthetic and other point of view, he is matched with the donor. The donor is matched. The other way of doing a recipient surgery is cadaver transplant or a deceased donor transplant, wherein we take out the kidney from a deceased or a road traffic victim who is brain dead. We take out the kidney from him and we transplant. But usually the waiting period of that is huge. So most of the patients, especially the young patients who are having kidney failure, are advised to undergo a live related transplant unless until they don't have a suitable donor. Kidney transplant is a safe procedure and usually it takes around 5 to 6 hours of surgery. Once the patient undergoes the surgery, he is kept in ICU for 3 to 4 days and he is monitored closely, his urine output, how he is doing, his vitals and all. Usually if everything is going smoothly, the patient is started on orals, that is oral feed and all, the next morning onwards, and usually after 24 to 48 hours patient is asked to move around. He will be with catheter, urinary pipe, which we usually remove after 5 days of surgery. And usually after 5 to 7 days, once all the biochemical parameters are fine, the patient is good, he is discharged. But like any other major surgery, it's a supra-major surgery, it also have got its own complication. Usually 90 to 95% of the patient do fairly well. 5% can have some complication. The kidney can get rejected, there can be hyperacute rejection, or it can get rejected in long terms. There can be urinary leak, bleeding, because we anastomose the blood vessel to a newer vessels. There can be bleeding there, infection. So all these complications can happen, but majority of the patient do fairly well. So in case there is anyone who is having a kidney failure, discuss with your nephrologist as well as urologist whether he can undergo kidney transplant or not. Kidney transplant is a safe and a very viable procedure and can be done effectively. Thank you.